Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Colleen Berry, the chair of the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health, talks with Dr. Vivek Murthy, currently a distinguished policy scholar at Johns Hopkins and the 19th Surgeon General of the United States. They discuss loneliness, human connection, and COVID-19. Let's listen.
Vivek, thank you so much for joining me today. When did you first start thinking about loneliness as a public health issue?
Well, Colleen, it's good to be with you today as well. I started thinking about loneliness when I was at the very beginning of my tenure as Surgeon General, when I began seeing in so many of the stories I was hearing across the country, these threads of loneliness that were unexpected. And I would hear people say to me, I feel like I have all these burdens in my life that I have to carry by myself. Or I feel if I disappear tomorrow, no one would even notice. Or I feel invisible. And hearing that again and again, it became clear to me that this was more than just a one-off phenomenon, but this was a pattern. And it was a pattern that reminded me of two things. One was my own personal experiences, struggling with loneliness as a child, and then later at many points during adulthood. But it also reminded me of my experiences in medicine, taking care of patients and recognizing that so many of the people who came in through the doors of our hospital came in alone, and they remained alone for the duration of their stay, even when we had to go through really difficult discussions about a new diagnosis or make tough decisions about treatment. They often were by themselves in navigating those very difficult conversations. So I was reminded of those experiences when I was Surgeon General, and it's what clued me into the fact there was something bigger happening here. And as I delved into the science behind loneliness, I began to understand that not only is loneliness common, but it's also consequential and that it has significant impacts on our health.
Now, these concerns about social isolation have become quite acute as we've been social distancing, and our ability to connect with people has really been profoundly limited. Tell me how you're thinking about loneliness now in the context of COVID-19.
Well, COVID-19 has been such an extraordinary and unusual experience for all of us. It's a kind of pandemic we haven't experienced in more than a century. And in addition to striking fear into so many people's hearts as they worry about their loved ones and as they face a great deal of uncertainty about their own job prospects and about when we're going to get back to normal, there's this added layer of physical distancing that we're being asked to observe. And what is so striking about that, Colleen, is that during times of great stress, of which this pandemic is one example, what we typically do as human beings is we look to our relationships to help reduce and manage that stress. We call a friend, we go visit our sibling or our parents. But this is a time when we can't do that. And so it's doubly injurious in a sense. And I think we could go down one of two paths when it comes to COVID-19 in terms of how it affects our social health. I think he can either take us down the first path, which is that of deepening loneliness, where we feel more and more separated from each other, the more we're not able to see each other. And the more that happens, the more I believe we're at risk of incurring social recession, if you will, marked by deepening feelings of isolation. Because we know that loneliness is associated with poor health outcomes, including an increased risk of cardiovascular disease and depression and dementia and anxiety, and even premature death, this is not inconsequential. It helps us understand that loneliness is more than just a bad feeling. It affects our health. It also actually affects our performance in the workplace. It impacts how our kids perform at school. And so that is one worrisome path that we could go down. But there is another path I think we could take. And that's the path of not social recession, but social revival. If we look at this moment and see it for what it is, which is in a moment that's unveiling and reminding us just how important our relationships are. Then we can take this opportunity to step back and take stock of our lives and to ask how we can double down on our relationships by investing more in time with family and friends, by ensuring that we are improving the quality of time that we spend with people we love, by eliminating distraction when we're talking to others. It's also a time where we can lean into service, recognizing that service is a powerful antidote to loneliness. And when we reach out and help others, we not only remind ourselves that we have value to bring to the world, but we also establish a wonderful connection with them in the context of a positive interaction. And so service is especially important now because a lot of people are struggling. Regardless of who you are and where you are in the country, all of us have had our lives turned upside down in some way, shape, or form. And whether we're struggling with figuring out how to homeschool our kids or how to make telework actually work, or how to manage with a job we may have recently lost, or how to deal with sick parents or other family members, we're all struggling with something. And service doesn't have to look like going to a soup kitchen or volunteering at an organization in the community. And in this day and age, service can look like calling a friend to check on them to see how they're doing. It can look like dropping food off to a neighbor who may not be able to go out and get groceries. It could look like offering to virtually babysit for 5 or 10 minutes so that your friend can have a few moments to just sit down and breathe. These are all powerful but important acts of service that can have the double benefit of strengthening how connected we feel to others.
So, Vivek, you have a new book that just came out this month, and it's called Together: The Healing Power of Human Connection in a Sometimes Lonely World. One theme from your book was that our world has changed even before COVID in ways that have the potential to make us, I think, all more socially isolated. And some of this has to do with the evolution of technology, right?
It does. In the modern world, we have extraordinary conveniences because of technology, and it's added a rich, rich layer to our lives. Technology, when used right, can strengthen our connections. When I was a small, Colleen, if I wanted to talk to my grandparents, my relatives in India, I had to write letters to them on these blue aerograms that took 2 weeks to travel halfway across the world, and then another 2 weeks for them to write back. And that was tough. But in the modern day, we can use technology to speak to people around the world whenever we want. And that's a powerful tool. We can also use technology to connect with people offline. When we're visiting a new city or town, we can send a message to our friends asking if anyone is available to meet up for a meal. And that can be a powerful way to reconnect. The worry I have about technology, though, is that I think the way we are using technology, many of us, is in a manner that's actually diluting and weakening our connections with each other. And that happens in a few ways. One is when we're spending more and more of our time with technology and in front of screens, that starts to crowd out our time in person with people. The second challenge is that when we allow technology to encroach on our conversations with others, distracting us as we check our Instagram feeds or refresh our inboxes or Google questions that pop into our head, thinking all the while that we can multitask and it's okay, that actually has a deleterious effect on the quality of our conversations, because the science is really clear on multitasking that we can't do it, that we think we're multitasking, but we're in fact switching rapidly between tasks. And if you've ever had the experience of sitting with somebody when they're listening to you deeply, when you have their full attention, when you're able to share openly with them, you know that that is an extraordinarily powerful experience. It's the experience of feeling truly seen and truly listened to. And 5 minutes of that kind of conversation can often be worth more than 30 minutes of distracted conversation. But in the modern age, it's not easy to keep technology out of our interaction. So the diluting effect is an important one. And finally, and perhaps the most insidious effect of technology, is that it has this perhaps unintended but still important effect of eroding esteem for many people who use it. And it happens in the following way, because there was a culture of comparison that existed in society where we judged our value and our worth in comparison to other people's. Was our house as big as theirs? Was our job as fancy as theirs? Was our office as sizable? Was our income as high? And social media has dramatically accelerated the culture of self comparison. We can now just look at people's lives through the lens of their social media feed. And what we end up doing when we do that is we compare their best days to our average days. And we always end up feeling like we come up short. So that self comparison can over time make people feel worse and worse about themselves. And it can perpetuate this feeling that we're not enough. The message I worry that young people get increasingly over social media and even traditional media is that they're not thin enough, not good looking enough, not smart enough, not popular enough. Those messages are usually attached to an advertisement for a product or service that will fill that need and make you enough. But the point is, if you're constantly feeling like you're not enough, what happens is that you're actually in a weaker position when it comes to connecting with others. Because when we approach other people from a place of insufficiency, when we're seeking validation, then what happens is we end up trying to be somebody else in those interactions, trying to be who they think, who we think they want us to be, or who we think society would approve of. And that can become a lonely experience very quickly. That was one of the common patterns I found when writing this book is when people existed for long periods of time in environments where they felt like they couldn't be themselves, whether that was in the workplace or on college campuses or even sometimes in their own homes, then they became lonely very quickly.
So let me probe a little bit more about technology in the context of the lives that we're living right now in the context of the pandemic. The first is that can we make those kinds of more profound connections with people through Zoom, through technology? I know we don't have necessarily research on this, but sort of what is your intuition?
My intuition is that we can. And I think because, and I believe that because I think it has already happened during this pandemic, but long before this pandemic, there were examples, many of which I came across, of people who were using technology to build deep and meaningful connections with each other. But there were some interesting principles that they followed in doing that. So, number one, when they were video conferencing with someone, for example, or talking to them on the phone, they would give them their full attention. They wouldn't multitask with other platforms and devices at the same time. The second pattern that I observed is that they would also draw boundaries in their life around where technology was allowed to enter. So they would keep time for solitude for themselves. And if they were living with other people in the home, they would keep time for face to face interaction with them that was free of technology. So that was also a key point here. And the other thing that they would do is they would use technology to interface with others with regularity. They would use something I came to think of as a ladder of engagement to figure out how best to interact with somebody. So they would recognize that texting somebody was a way of interacting, but it was a channel that had the least amount of interpersonal context. So they couldn't see the person's face, they couldn't hear their voice, they couldn't. They didn't have the benefit of assessing body language. So it was a very limited amount of input. And it was often not even sentences in text, but short fragments and emojis and acronyms, etc. Moving up from there was emailing someone where you may have more room to actually write. Up from that was making a phone call to someone so you could actually hear their voice. One step up from that was video conferencing with them so you could hear their voice and see their face and see the context of what was happening around them. So whenever possible, they would try to move up that ladder of engagement. Here's a simple example of that. When people call you on the phone and you don't have time to have a longer conversation with them, what do most of us do? Well, I'll tell you what I have done over the last few years is I've tended to decline the call and then send them a text saying, "Hey, can I call you back later? I'm tied up." But what I realized is that didn't feel great. And instead, I started changing to picking up the phone when they called and just saying the same thing that I said on text in just as much, if actually not less time. "Hey, so great to hear from you. I can't talk right now. Is it okay if I call you back in half an hour or tomorrow?" And just that 10 seconds, 15 seconds of them hearing my voice and my hearing their voice, it made a difference. It actually made me feel more connected. So these are some simple principles that I found that people who use technology to strengthen connection use. And in doing so, they prove the point that technology at the end of the day is a tool. It's how we use it that determines whether we strengthen or weaken our connections.
So, on this topic, there's been a lot of discussion very appropriately about the digital divide. If technologies like Zoom are one of the primary ways we are connecting with others in the context of social distancing, what does that mean in terms of social isolation for the subset of our population living without financial access to these technologies?
Yeah, I think, gosh, it's such an important question because I think what's happening right now is that we are finding that we're having to lean on technology so much more so than we have for human connection. But we know that access to technology is uneven. So one thing we know is that for minority communities, they often have less access to broadband services and to portable electronics. And that disparity in terms of access to technology is going to put them at a disadvantage in a moment like this of staying connected to other people. It's not just true of minority communities, but think about the elderly, think about people on the lower end of the socioeconomic spectrum. There are so many stories that I have been hearing in the last several months about seniors who are isolated in nursing homes, unable to receive visitors, but who don't have both the technological savvy and as well, or the devices to be able to connect in a reliable way with their family and the outside world. And that is heartbreaking because at a scary time like this, you want people around you. And we know that nursing homes are hotbeds for the spread of COVID 19, and it's a scary place to be. Especially if you're alone. So, we do know that access to technology is uneven. And coming out of this pandemic, the one thing that we have to think we recognize is that COVID 19 has really pulled the curtain back on a series of holes in our infrastructure as a country, holes that are unevenly distributed across the population. So, whether we're talking about access to technology, or whether we're talking about access to healthcare itself, or whether we're talking about complete and sufficient coverage for not only physical health, but for mental health services, we're finding that there are a lot of gaps. And at moments like this, when our health system and our country is stressed, those gaps get revealed. And we pay the price for them in human suffering and even in terms of lives lost. So that's why I think that once this pandemic is over, but even before starting now, it's really critical for us to fill these gaps.
So, my last question actually picks up on just that point. Is there anything about the pandemic or our response to it that can help us lay the groundwork for less social isolation in the future? At some point, we're going to get beyond this incredibly challenging time. And I'd love to think that there was some kind of silver lining, something positive in terms of human connection that could come out of this.
Well, yes, I do think there's a very, very large silver lining, I think, in this pandemic that could result in terms of a greater focus on human connection and relationships. And I think it's already starting to happen to a degree because when the chips are down and when we're in the midst of a crisis, that's when you see what people are really made of. That's when people's humanity really comes forward. And you're seeing that in nurses and doctors and respiratory therapists who are stepping up and putting themselves in harm's way just because they took an oath to take care of those who are ill. You're seeing that in neighbors who are dropping meals off at the homes of fellow neighbors who are in need and who may not be able to go to the grocery store. You're seeing high school students, sewing masks that they're dropping off at hospitals and clinics in their communities because they know that first responders and frontline workers need help. This is what we do as people. In our moments of crisis, we come together. That's actually our instinct. I say this very explicitly because there is a thread in our larger narrative as a society that says that we all just look out for each other. That's how we're built, that self interest is what governs the human race. I don't think that's true. I think that over thousands of years, we have evolved to be interdependent creatures and that we have seen through the test of time that we are truly better together. And I think that's why in moments like this, we reach out to others to help. It doesn't mean we do it as often as we should or that we aren't anxious or worried when we do it, but it is our deeper instinct. So as we reflect on that, I think this is our opportunity to not only recommit to relationships in our life, recognizing the tremendous power they have for healing, but it's also our chance to think more broadly about what kind of society we want to live in. And I want for myself, for my friends and family, for my children, most importantly, to have a society that's built around people, that's truly people-centered. And what that means is that such a society thinks about how to strengthen relationships when it designs its workplaces. It thinks about human relationships when designing curricula in schools, recognizing that our children need to have a foundation for building a healthy relationship. And that's just as important as anything else they may learn in school. Truly people-centered society also thinks about relationships and community in the context of public policy, recognizing the decisions that we make about housing and transportation policy, these affect communities. They affect our connection with one another, and that has to be taken into account. COVID-19 is a wake-up call on so many levels, but it's also a wake-up call to us to refocus on the building blocks of society. And one of those are our relationships with each other. I think we have to reassert kindness and compassion as core values in society. I think we have to recognize that service is one of the greatest connectors that we have. And I think we have to make relationships a priority in our lives. Those are the centering values that we have to now rebuild our lives and our communities around. When I wrote this book, Colleen, people often ask me, is there a one-line summary of the book? And I would often say, no, I'm generally not good at one-line summaries. But as I have reflected deeply on the stories that people were so kind to share with me when I was doing research for this book, there was a theme that emerged. It was actually just 3 words that kept coming up again and again and again as a lesson to their stories. And those 3 words became the credo, not only for this book, but for the life that I personally want to lead, for the society that I want to be a part of helping to build. And those words are put people first. Those 3 simple words. And I think when we live with that value in mind, with that credo in our hearts, it guides us to build the kind of people-centered life and world that we need, the kind of life that will make us stronger, healthier, and ultimately more fulfilled.
That's a great note to end on. Vivek, thank you so much for joining me today.
Thank you so much, Colleen. It's great to talk to you.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.